Welcome back, joined today by Dr. Amber Robbins. Thanks so much for being with us.
Yeah, no problem. Good morning.
Good morning. We've seen the change of seasons, and this means one thing for a lot of people. It's time you're probably going to get a cold.
Yeah, it happens every year, and we see a lot of patients who come in with cold symptoms, wondering what to do.
Right, what exactly is a cold?
Right, so a cold is a viral infection. So it's common. You usually get it from germs if you're just touching different things, or you're around someone who's cold, then you can get a virus from them. So it's the runny nose, the headaches, the cough, the congestion, all that together. That's a common cold.
Everyone has what they believe works, or they want to know which of those remedies they find on the internet work. So what does work to treat a cold?
Right, so let's keep it simple. The first thing is over-the-counter medications. They actually do work. So with viruses, the thing is we can't necessarily treat the virus, but we can treat the symptoms. So if you're having that nasal congestion, if you're having the runny nose, the ear pain, so looking at things like Dayquil, NyQuil, Tylenol, cold and sinus, those type of things work. Also, if you notice that you're having a lot of runny nose, using a nasal spray like Flonase, that can help with the symptoms, but especially with that medication and others, you should talk with your provider, your medical provider about it. And then if you're more of a natural type of person, you can even try zinc. Research has found that if you use zinc the first day, the first 24 hours of actually having the cold, you actually may be able to shorten the duration, how long you actually have it. So that's something to try.
And what doesn't work? What kind of things have you heard that people say they use or they've tried that just doesn't work?
Right. Antibiotics. Everybody wants antibiotics, and I can understand that because a lot of times you hear, oh, if you give me antibiotics, that'll cure my cold. It actually won't, because antibiotics don't necessarily treat, well, they don't treat at all viral infections. They treat bacterial infections, which is a separate category of infections. So with a virus, it's not going to work. Also, some nasal sprays, so the saline sprays, that doesn't necessarily treat a cold either or treat the symptoms, but it does make you feel better. It does help with, if you put it in your nose, it does help with the moisturizing your nose. But again, it doesn't necessarily help with the symptoms. So again, with all of this, make sure you talk with your primary care doctor or your medical provider about it, because if you have different comorbidities that we say, or if you have more stuff going on like high blood pressure, diabetes, then these are the things you need to run past them before you try any medications.
All right, thank you so much, Dr. Amber Robbins. This is a conversation a lot of people going to want to pay attention to, especially as we enter that cold and flu season.
Yes.
Again, thanks
We're there.
Thanks for joining us. And if you missed any of this conversation, we'll have more details and the video on our website at ROCHESTERFirst.com.